Could you talk about natural products that help depression?
Mhm. Yes. Yeah, in my practice, I've had tremendous success with the amino acids that provide serotonin that will allow the brain to manufacture serotonin. Serotonin is probably the most important antidepressant and sleep aid that there is. Serotonin is the brain chemical that makes us feel mellow, makes us feel relaxed, we're less anxious, we're less depressed, we sleep better, have less nightmares, our bowels work better, we have less pain. People who are serotonin deficient because of inadequate ingestion of the amino acid tryptophan are more likely then to have more pain, sleep less well, be more anxious, more depressed, have bowel problems. So that alone is a tremendous help. And so when I have somebody that isn't on a drug, I rejoice. I thought, oh, we don't have to go through all this withdrawal stuff, we can get right to the nutrition. So that's my favorite patient because, and they invariably improve. I mean, I suppose there are some exceptions. Maybe somebody is already eating well enough so they aren't deficient. One of the problems, of course, is blood tests don't help. We can't tell. Yeah, we can't tell the serotonin supply in the brain by a blood test because the serotonin level varies with the last meal, I mean, or the tryptophan level. You can measure tryptophan in the blood, but it's pretty hard to extrapolate that information, in my opinion, to what's going on in the brain. So, and they're very expensive. So serotonin is important. If you're feeling sad or blue, then the natural antidepressant dopamine or norepinephrine needs to be supported. So I often will prescribe tyrosine. These are both 5-HTP, the precursor to serotonin, and tyrosine, the precursor to dopamine and norepinephrine, are quite inexpensive. So I use those. And of course, in order to for the brain to metabolize those substances, we also need a variety of minerals and vitamins as well.
When should you take these amino acids, these supplements?
Good point, yeah. Since serotonin tends to be sedating or calming, it's probably best and helps enhance sleep quality. Probably best to take the 5-HTP at bedtime. Although it's not that heavily sedating, so a lot of people take it in the daytime. By the way, 5-HTP and serotonin suppress appetite. So it's a good appetite suppressing, natural appetite suppressant. It's an impulse control neurotransmitter. So if our brain is well nourished with serotonin, has plenty of serotonin, we can not eat that second donut. And it's more easy to just resist the impulse to do violence. It has an anti-violence effect to serotonin. So when someone's depleted on that, or if we're having any of those symptoms, we can say, maybe that person is serotonin deficient, and let's give a therapeutic trial for that. Many times I do that. As far as the tyrosine is concerned, since dopamine is an energizing dopamine is the natural energizing antidepressant, we probably want to use that in the daytime because you don't want to be energized at night. So the tyrosine I usually have them take in the morning and the 5-HTP at night. So neither one of them are that potent. It isn't like taking cocaine, As far as the vitamins are concerned, it probably doesn't matter too much when you take those, although vitamins, if someone's vitamin deficient, they're probably fatigued and tired and sluggish, and so when you start taking vitamins, people will say, oh, I feel a whole lot better and more energized. So vitamins may be energizing and maybe should be taken in the day, but it's, again, a minimal effect.
But there are no side effects from the 5-HTP or the tyrosine? Or
No, the only 5-HTP, I think, can sometimes, if you take a large dose of it, large doses, it can probably cause nausea or indigestion. That's about the only side effect. That's the nice thing about nutritional supplements. You probably can't overdose on them, by and large, except some minerals you might be able to overdose. And you don't have withdrawal symptoms when you quit, and they're inexpensive, and they're healthy. It's a win-win-win-win
So it's like,
situation.
duh.
Yeah, why don't we should do that first, instead of jump right to the drug.
Well, the little prescription pad's handy, isn't it?
It takes 2 minutes to write a prescription. It takes 20 minutes not to write a prescription. So if we're short of time, doctor is double booked, he has to see 30.5 patients that day, he's going to reach for the prescription pad instead of get into the complex issues to look at the root causes and help the patient with the cure. He's going to be more likely to write a prescription. And getting off drugs, helping people get off drugs, you can't do that in 2 minutes either. So it takes a long time. So what gets done in this high productivity medical system, you do the quickest thing, is churn the patients out. As far as when to take the others, I myself take fish oil and several different vitamins and minerals, and also certain amino acids. Amino acids can build up in the body, though, so we don't have to take amino acids for the rest of our lives.
Okay.
You don't have to take vitamins for the rest of your lives. I think that what I recommend and do myself is recommend taking certain nutritional supplements if we have strong suspicion of deficiencies, and then for a while do that, maybe a bottle or two, maybe a few months, and then try to taper off, and then rely on the food supply to provide. That's the best source of vitamins, is food supply. But you have to eat organic to have any confidence that the food has the right vitamins and minerals in them. So it's a lot of work. You have to educate yourself, but we don't necessarily have to take these things the rest of our lives. I think we should all probably be taking a high-quality multivitamin mineral with trace minerals in there. I don't take them every day, though, because I eat fairly organically. But I do take my essential fatty acids in the form of fish oil, flaxseed oil. I take those every day. I think that even organic food is probably deficient in that, or it's harder to get. It's hard to eat salmon every day. So there are some things that I think maybe we should take on a regular basis. Some we should take for a while. Some we can maybe get by taking intermittently.
All right. Good advice. Thank you.
You're welcome.